doing this orientation, and this one cannot turn that way. Please help me with this one. Everyone needs to push your life. Yes. You are live, sir. You'll never look at that building once capacity. Financially, health-wise. Everyone can be better. Cause it's taking you higher, hey. You can be entertained and so educated. Making you so independent.
Good evening, Patu. Good evening, Nigeria. Now, welcome to this beautiful Friday evening edition of our program, My Word for Life and Living. My name is Dr. Kingsley Mayowa. I'm a consultant psychiatrist. I'm a certified management consultant. I'm an associate professor of addiction, social and rehabilitation psychiatry at the University of Jos. Today with our program, an initiative of the network group to help you to acquire the mindset, attitude, and aptitude that you need to make a success in any and every area of your life, be it governance, be it business, or even your career. To also help you to achieve and maintain a sound mind so that you can live the life of abundance that you desire. On today's program, 7, we had children. Many always go through developmental issues, and one of the developmental issues that we notice is the issue of drug use. Somebody has said that drug use is a developmental issue, and so today we'll be talking about prevention of drug use and drug use disorders in children. The prevention of drug use and drug use disorders in children. As you are well aware, as an associate professor of addiction, social and rehabilitation psychiatry, this is one of my domains, my purview. However, because we're talking about children, I brought a distinguished scholar and colleague, Dr. Friday Philip Tunchama. Dr. Friday Philip Tunchama, then psychiatry at the University of Jos, and consultant child and adolescent psychiatrist at the Jos University Teaching Hospital. Dr. Tunchama, it's nice to have you on our podcast today.
Thank you for having me.
All right. So we will just be launching straight into the program. However, there's something we usually do for our viewers to get to know the person that we're dealing with. So we're going to ask you a few, let's say, personal questions like about data. To say, okay, Dr. Tunchama, can you give us a background about yourself, where you are from? Now, because you are Friday Philip, it's only the Tunchama that shows that you're in Nigeria. So, where are you from? Your educational background, your marital, anything that you believe that we should know about you, so that people will be acquainted with who we are dealing with.
Thank you very much.
Yes.
As you said, my name is Kanoki. From Kankia local government area of Plateau State and regards by tribe or by ethnicity. I'm married. I got married in 2007 to my beloved and lovely wife, Vihina. We have 2 children, 2 boys. I started my education way back in the late 70s in a village called Chip in Panshin local government area council of Plateau State. From there, I came to Jos and transfer. My father 1984 and I finished 1990. From there, I went to have a stint with the University of Jos before I left for Zaria to do medicine. Zaria, where I spent a lot of time because of delays, ASU strike, and other things. So eventually I graduated and I did my housemanship in Youth University of Johnstown, where immediately I finished a residency program in psychiatry,
Okay.
where I spent a couple of years there. And then from there, during the residency program, I had to go to Ibadan to go and read masters in child and also in mental health.
Okay.
We were the pioneer students of that program. It was a program that was scheduled for West African, for
Okay.
they have a fewer number of professionals
Okay.
in the child and also mental health. So we are 15 that we started and we graduated in 2014. From there, I returned back to Jos and continued with my work as a child and also mental health professional and sometimes as a consultant psychiatrist with the University of Jos Teaching. And then now I'm a professor with the Department of Psychiatry. So in a nutshell, this is my biodata autobiography.
That's a very rich one. So you have been thoroughly trained. Of course, there are people who will go for 1 or 2 weeks training. They will say, but you have been trained rigorously in psychiatry and even in child and adolescent psychiatry. All right, so you are right to talk as an expert on the issue that we're talking about. All right, yes, so we're just going to go. We're just going to talk as an expert. We're just going to launch immediately into the program. What do we mean by prevention in terms of drug use, especially in children?
Thank you for that question. Prevention is a method of activities that one is involved in.
The Bluetooth device is ready to pair.
In either stopping somebody from doing things that are going to be harmful to that individual, or to prevent it from continuing to be the harmful stage.
Okay.
With children, in children is an activity that we do undertake to what? To either not to even initiate any use of drugs, because we know that the consequence of use of drugs is very is dangerous. It affects not only the child but the society as a whole.
Okay.
So it's an activity
Okay.
one that does. We involve ourselves to do with the child or with the parents to prevent, to stop the child from either using drugs or initiating it or continuing the use of drugs.
Yes. All right. So from what you have said now, if a child has not even used drugs before, we want to do everything to make sure the child does not start using drugs.
Yes.
But if we have asked somebody that one way or the other has started using, and used drug, we now want to make sure that this person does not continue use of drug, so that it does not get to the point of causing problem for him, maybe young drug use.
What I say, point of no return.
All right. And the interesting thing, you are the expert in children, but the interesting thing is that because children are developing and their brains are still developing, a child that starts using drug at a early age, it's as if the brain will now develop with drug, and those people seem to be more difficult to handle when they now have drug use disorders. So what do you have to say about that?
Yes, the brain keep on developing, get matured at the age of 25 for the male.
Okay.
For the girl, for the female, at the age of 23, the brain is fully matured. And the brain has so many parts. So there's part that improve, tell us about how to get pleasure.
Okay.
Yes, we know drug give us pleasure.
Yes.
To give children pleasure. So those parts will also develop as opposed when this part are not well matured. You know, the brain cannot handle those drugs. So it goes beyond that child's capacity to be able to stop the use of those drugs. And the part that also control how to inhibit or to stop also does not grow with as it grows more slower than the part that controls your memory, that stores pleasurable activity that you have done. So because of that, it's more it's more problematic for the child.
So the child is at disadvantage.
It's at disadvantage.
Because what to be able to check him is going slower.
It's going slower
Than all the other ones.
Yes. So yes, and that one is the one that most mature last to beat the use of the drug or use of anything that will you become addicted to. Yes.
So the child is now
at a disadvantage. And
Mm.
most likely for the boy child. Because it's one more mature, the whole group when mature at later stage.
But the female child matures faster.
Yes.
Interesting. It's all right. So now, from your experience and from what we know, what are the most effective strategies for preventing drug use among children and adolescents?
Well, there are a couple of strategies that one can use to prevent drug use in children. Now, let's start from the home.
Okay.
Yes, parents have a key to play in preventing the use of drugs in children.
Yes.
Parents should be open to discuss the issue of drugs and substances to children. Because lack of opening up, children will not know the danger, the consequences of use of the drug, or the effect of the drugs on their health and society. So the first thing the parents should teach their children to talk to their children about the danger of these drugs. Then also the parents should be in a position to also monitor their children. Wherever they're going, when we talk about drug use, we're talking about adolescents. Some parents say, "Oh, we're living in a modern world, civilized world. My children have the freedom to do whatever they want to do. We need to monitor them. Parents need to monitor children's activities, whether with friends, whether on the internet, whether in school. You need to be checking to find out what are they doing activities. And they also parents need to tell their children to be assertive. Because when you meet children, they tell you that they've started smoking, start drinking alcohol because I'm trying to peer pressure. My friends are doing it. I want to fit into that society. They create groups in schools. So and parents need to teach their children, okay, be assertive. Say no to this. This is not what we touch at home. This is not what we do. This is what we don't do at home. So my mother is going to get cross when she hears it, or my father is going to get cross when she hears that I'm going to use drugs. So the best thing is for the parents to tell the child, say these words to anybody, turn your back. Some people will go to with this modern technology. Some will also use phone. I mean, tell the children when you engage when you are being engaged by a peer group to use drugs, can you just text this? So the parent will put the number of the child on notice, notification. Maybe take the word X. Escape. So the parents will know that my child is in trouble. So he's trying to what? Mingle with his brain.
So they will
also take action. Maybe call a teacher in school, or call anybody that the child told you is going to this house. That please, can you see my child? Something's going on that I don't understand. So there's a way of the parents trying to make sure there's communication between the two of them, so that the child will be able to tell them when he's in danger, and then the parents can do something. Another thing again, we need to also educate the general society about our culture and tradition. Some culture permits the use of drugs. I remember when we were growing up in my village, you find if the child is crying, they say, give me kunu. Some grandmother won't give the kunu, they will go and give the local brew. Yes, as kunu. Yes, kunu. And the child will start, that's where you the child to what? To such things. So we need to drugs in the society. And occasionally, some parents buy substances, come to their house, to come to put in the house if they're using drugs, if they're using substances too. So we need to educate that no, that should not be done, because it's a cue for the children to go and use drugs later in life. Other things that we could tell the parents or the society could do is also educate our teachers, how to communicate, how to pick some what we call paraphernalias of the use of drugs in children. When children start attending from school, start becoming truant, become delinquent in school, you know that something's going on. Or when you find that the child suddenly starts, his performance starts going down, dwindling, you know that this child is not doing well. Something is going on. He might have started using drugs. So we need to talk to the society. And also, we need to put some laws laws to really prevent the accessibility, the affordability, and the promotion of the use of these drugs. That will help us in preventing use of drugs in children or the abuse of drugs in children.
From what you have said,
And also, there's another thing I want to point out. Now, sometimes some children, some homes, we have medication.
Okay.
Yes. So we need to put medication in safe places where children could not reach.
Okay.
Because if we go and use, if the child is maybe, let's assume the child is a sickle cell anemic patient, the child could also have access to painkillers.
Okay.
So he could also start abusing painkillers because of pains. So we need to keep the drugs out of the reach of children. So that will also prevent them from not abusing drugs.
Thank you very much, Dr. Kinchama. You have given us like an expose on how to prevent the strategies to prevent drug use in children and adolescents. But from what you have said, one very important thing that I got there is that it seems as if parental skills, parental involvement in their children is one of the most critical and important ways of preventing drug use in children. So because from that was the first thing you started with, to make sure, and we as addiction psychiatrists, we know that parental skills is one of the most, and you know, most people will not think about it in that way when they are talking about prevention of drugs. Most people will think in terms of all these promotions, all these media campaigns, saying no to drugs and all that. But the general parental skills, if we put so much effort into it, it's going to help people not to even think of or even initiate drug use at all. And so, viewers at home, that is one important thing that we have seen from this discussion. We as parents should have time for our children, not just think about chasing money and believing that, we are doing it for them. We must be involved with them, know what they are doing, know their friends. He even talked about having communication with them. Child can naturally send a message, a cryptic message to show that he's in danger and all that. It is when you cultivate that line of communication to make it open, children will be able to do that and all that. Another thing he also talked about is in the issue of policies and laws that governs the issue of substance and all that. So I think that one of the things that you are trying to say there, from what we understand, is that when the government have policies and policies that prevent young people from being exposed to drugs early. For example, they talk about alcohol not being advertised at certain periods of the day until maybe later in the night when children ideally should have been asleep. They talked about
in fact, that this time issue of no advertising in some countries, like in Iceland, I think, the government has banned the use of advertisement of anything alcohol.
Totally. Not even in the night.
Not even in the night. You see? So, and the only way you can even get beverage alcohol is a drug. We don't. The politicians want to shy away from it. It's not a drug. It's a beverage. That thing they get. But in that case, you cannot even get alcohol in any store. It's only government stores.
So it's regulated.
So the use of media to promote drugs, alcohol is not even there, and that thing has brought down the percentage, the prevalence of drug abuse in children by almost 40%.
40%.
So you can see
that's a lot.
And then you talk about parenting too. You know, we are so much engaged in career pursuit and other things, neglecting our homes. You know the spending of the quantity of time that matters. The quality of time.
The quality of time. Okay.
Sometimes you find that the parent will just say, okay, I'm going to work for 5 days in a week. On Saturday I'm going to spend time with my children. No. Also the frequency of you spending time with your children. But the more you spend time with them, the more children feel attached to you.
Okay.
The emotion, you're bringing emotion with them. When I touch you, whenever, even if it's going to be just for 5 minutes in a day, for 7 weeks, it's better for you to have only 1 hour, 1 day.
And then the rest of the day
you are busy doing something else. You don't know what's going on behind.
So it's still the same thing that we used to talk about. That consistency is more important than intensity.
Yes.
Beautiful. Thank you very much, Dr. Tuchama. Let's move on, because usually time flies when we are here. Now, a number of parents will say, in the course of our work, we see that parents say, for this boy, blah, 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 and how did he get to this level and I didn't know. So can you educate our viewers at home?
All right.
Some of the signs that shows that a child is already getting into drug use. Some, or at least some.
Before I go into that,
yes,
we need to know that what are those causes of drug use?
Beautiful.
Use.
Yes.
We need to know. There are major two things. The genetics plays a lot, and the environment.
Genetics. Can you break it down?
Yes. The biological makeup of the child.
Okay.
If the child is made to use drugs later in life, there's a biological clock that will kick in.
And where does the child have this biological makeup? Where does it come from?
During conception.
Okay.
When the father and mother needs to conceive that child, that's when the biological thing comes in. And sometimes we find that by the father, maybe one of his relatives, or he himself, or the mother herself, is using drugs. So it's like the genetic makeup in them. That the child can also inherit and start using. But then, the biological aspect is just about 40 to 60%.
Okay.
The rest is mostly caused by
environment.
And the environment could be some of the risk factors are that there's a sibling, or there's a brother, there's a sister, there's a relative that uses drugs, copies it, and start using it. You find it's something good. The society, we glamorize, we glorify some certain adverts that are being done by celebrities. So the child sees a celebrity that he likes, and he sees that person smoking, maybe advertising cigarette, advertising alcohol. So he follows it. So you see the society is playing, or the environment is playing a role on the child. And then another thing again, we should know that there's this peer pressure that affects the child. Okay. The child wants to fit into whatever group he belongs to. And the only thing you can fit in is to follow along, follow what they're doing. And then when you experiment, children are very good in experimenting with things. They want to test the environment. Okay. They want to, sometimes I used to tell some people that they won't ask me why is lying in children a normal thing. I said no, it's normal. Okay, lying in children is normal. Okay. Any child that doesn't lie to me is not having good idea. It's not developed. It's not developed. Child will argue to test you. Okay. So children do experiment to test the environment. Test whether this thing I'm going to do is going to be recommended or not. So the son that use this experiment. So once you don't take action, then they push the boundary. Yes. They do it further. Yes. So this is good. They'll be maybe I'm acquiring this. My parents. That's some of the causes of this. But we have what we call paraphernalias of the use of drugs. When you see a child now, the child that was so much engaged in activities at home, start withdrawing, keeping to himself in his room. You start questioning, start asking questions. What are you doing at home? We used to be together as a family. A child that normally comes for, let's say, supper is supposed to start by 7 o'clock. It's late. There's something going on. Please ask as a parent. Then, now in commonly on the plateau, you see a child started using perfume. He's not used to using perfume. He's not using perfume. You know that something trying to cover up something. Or start looking tom sweets. And then sometimes parents, you should do. It's your home. It's your house. Check their wardrobes, their cupboards. You see that there's some element of maybe a wrapper, leftover something, cigarette, stump of cigarette, or lighter. The child has started using. And if the child, he has a particular friend that comes to the house regularly, you find the child is no more, that particular friend is no more coming to the house. Something that is a red flag, that he has changed friends. Or you in the particular child that smokes or drinks, and then you find that your child is now having
associated with
that person.
Mm.
It's also a red flag that you should try to find out what's going on. And then another so much glaring is that when the child's performance starts going down in school,
Child that is a high flyer before,
high flyer start going down. Ask
what is taking his time?
Yes.
Mm.
Those are some of the few things that a parent could check and use to gauge his child, to know whether the child is using drugs or something.
It's all right. Thank you very much, Dr. Kincham. Let's move further from the home. I like the way you have brought it to the pair. That parents will know that the real deal is in the home. However, we also know that children, people go to school very early.
Yes.
And then they have people outside their home having very great influence on them. You spend most of the time in school with peers and all that. So what are the roles that school can play in preventing drug use?
All right. There are so many. The rules is wide. Schools are also a place. So we need to start with the teachers.
Okay.
The teachers also have sees things in children that they also pick and say this particular child is using drugs. Let's use performance or school attendance.
Okay.
Let's assume that this child doesn't go. It's not his parent that not bring him to school, but he walks to school, and the child starts going to school. That he comes to school early, or occasionally not find the class. He's somewhere, or he has joined the friends twice.
Yes.
You know, so that one, the teacher should mark that child and put more eye on him.
Okay.
Concentrate more on that child. Then another thing again, if the child performance starts going down again,
yes,
it's a flag. It's a red flag for one to understand that this child might be something is going on. It could be the child is abusing drug, or there could be a family issue. Dynamics at home is really changing his performance. Maybe there's emotional breakdown, other things. Then again, the kind of friends this guy, the child keeps in school is also something that the teacher can notice and pick. If the child is involved in people that have some certain names, you know, there was a child I was seeing one of the schools in Jos, one of the schools in Jos. You know, they have a gang, they have certain names. So they have name. So and then if you find out that the teacher should know that there are some groups. Okay. And with some bad names, then and that child is in that group, you know there's something ongoing. Yes.
Okay, now that is recognizing
the
signs and all that. But what could the school now do to make sure that children generally don't get involved in drugs?
Okay. Yes, we do organize what they call to educate the children on the danger of the use of drugs. Okay. The effect and danger of the use of drugs, yes. Yes, and how it's going to affect them in the future. Because there's the short-term pleasure. We pay it by long time suffering. So the child should be taught and be educated in that. And so the school can also create what we call like playgrounds or play therapy. Okay. Or they engage the children in activity. Their mind off the drugs. Yes, you can develop their skills in writing, drawing, sports. These are
even competitions.
Competition,
including quiz competition.
I remember when we were in school, they thought of
you don't doesn't come to the mind.
You are so much engaged in so many activities.
I remember that the competition is who is going to represent the school. Oh, when you represented, we didn't win. When I represented, we won. You know those kind of things.
It's challenging.
Yes.
You have groups, and then you be challenging each other, and then activities are going on, and your mind is off the use of drugs. And then also there should be a two-way communication between the parents and
okay.
There's another thing thought that you check the use of drugs or prevent the use of drugs in the school.
Okay.
Yes.
Thank you very much. Viewers at home, At Network Consult and all our brands, one of the things I used to say is that we are a training organization and we have these modules that we use we train people, schools, the general public, parents and all that, because their understanding of the issue of drugs and everything will also impact on how they'll be able to parent their children and even in schools and all that. So if you are interested in getting to know more of this, we are going to put some of the information on our channels so that you can also be part of those trainings. Some people have received the training. We also know that teachers can also receive the training. We had a training at a time where we had some of school owners who have been able to undergo that training, and then of course it's having an impact in their own schools and all that. We also know that rather than having one-off educational programs, when teachers are trained so that they now have drug education as part of their curricula in school, so that just like you said, piece by piece information is on a regular basis, rather than one intensive one at a time. And then of course, evidence has shown that when their school teachers, as part of the curriculum, are the ones teaching them, training them and all that, it does better than when you just have maybe Dr. Okonoda or Dr. Tonchama just come once in a while, even once in a year, and just do that. So that's one of the ways in which schools can also help. Some schools want to shy away from the fact. Some of them believe that, okay, by the time they now start talking about drugs, they are saying that their children are using drugs. But that's not the thing. We must prevent it, make sure that children are well engaged. And just like you said, when children are kept in school by activities that they are in love with, educational activities, recreational activities, and all that, they are likely not to also get into drugs. So that's one of the things that school can do. Well, you have already told us a little about what I want to ask now, in terms of peer pressure, in terms of the influence of the environment on children and all that. So with that knowledge, to know that peer pressure is there, how can we, and then of course the environment, how can we mitigate against this? Because these are things that are practical. In fact, at the time I had a pastor whose child was using drugs and all that. He said, "Doctor, what have I not done for this boy? Why did I get it wrong?" And all that kind of thing. But when you look at it critically, you see that there are some lapses. We also know that sometimes, no matter how you do, because these are children growing into adolescence and they have their own ways and all that. But on a general level, what can be done to make sure the environment doesn't overpower these children, despite the fact that families are trying their own best?
All right. I usually in my practice, I normally tell parents and my patients, children, that we live in a very control you, control your emotions, control the way you talk, the way you speak, the way you do things, and your choices about life issues. So what I normally impacted on them is that don't let anyone choose you as a friend.
Okay.
Only the one to choose your friend. So with that in mind, you can beat down prayer pressure. Because prayer pressure, they will give you a certain incentive that that is attractive, that you want to join that group. I said, no, that group should join you.
Okay.
Because if you join the group, you're going to do the biddings of that group. When the group joins you, they're going to do your own biddings. So parents should teach their children and they will choose you as a friend. You choose the person as a friend. Because the person should not control you. So this is a way of trying to make sure that if you say you're going to a child say, okay, I'm going to create this prayer group.
Yes.
And this prayer group, this mode of operating and you find that your parents told you that kind of thing does not work for that family. So you should okay, let me create my own. That my family taught me that I should not smoke, I should not drink. That drinking smoking is not something good. So you are making them to understand that you are choosing your own, also make your own peer group. So the important thing is choose your friends. Don't allow them to choose you. Because the parents should tell their children. and the school teacher should also be taught that the children that don't allow you to don't be invited to a program. Rather, you invite the program to you.
So a child must be assertive.
Assertive.
So at the end of the day, it still boils down to what we're talking about. Parental skills, life skills.
So parents should teach their children that, and then us that we're in the field should also be enacting that continuously, emphasizing that this is what should be done. Okay. Because peer pressure has seemed to have a lot of advantages in the method of preventing drug use and addiction.
It's all right. So this question I want to ask now may be like begging the question, but what is the most critical period in terms of between children and adolescents? What's the most critical age that I know that people can get into drugs anytime and all that, but what is the most vulnerable time?
Well, studies have shown that between the ages of 11
Okay.
to 14, 15,
Okay.
children, then, as I told you earlier, the brain is not mature. That time that is more vulnerable for a child to start to use drugs and then to also become addicted.
Okay.
And at that time, it's going to be very difficult for the treatment to be effective. The brain is still not matured. And if the brain is fixated at that time, you know that so many things will happen in the nearest future. Wow. So that's the period that is more critical for this thing. And in this country, I think I encountered a child of 11 years that started using drugs, tramadol to be precise. He lives with his guidance, and they're into farming. So he saw them using tramadol to give them energy for them to stay much longer on the farm. So he started using drugs, and
because what parents do,
yes,
it's good.
Yes, it's a modeling.
It's a modeling thing.
So the child started from and then he developed some psychosis and he was brought to hospital. Wow. So that's that point, that 11 to 14, 15 is more critical.
So we as at home we can hear it that within the ages of 11 to 15, 14, 15 is more critical and most critical period. And children will usually want to copy what the parents are doing. So if you are taking alcohol, smoking, doing all those things, of course your children will follow. Well, so we have that responsibility as parents to make sure that we live right, so that we can always tell children to do what we do rather than just what we say. All right. It has been an interesting time talking with you, but we are going to go into certain areas now before we round up. And one of the things I want us to talk about are some of the misconceptions that people have about substance use, especially in children. Because as an addiction psychiatrist, I know that people have a lot of misconceptions. Some people they don't believe that it's a disorder. Say, we have talked to the boy, he's spoiling our family name, and we say, let him come to treatment. They say, which one is treatment? And all that kind of thing. So that's a misconception. And some people actually believe also that, the person that is using drug, you can see the stigma and everything will just be shown. So they get surprised when they say, this boy is a good boy, and blah, blah, blah. What are the misconceptions that you have seen as a child psychiatrist and the people who are using drugs?
One of the misconceptions about abuse of drugs in children is that parents or people tend to moralize that abuse or that use of substances, which is not right. Drug addiction or abuse, it's a very complex thing. It's a chronic and complex thing. It's like a brain damage. So it's now we are seeing the brain have been studied. When drugs are used, it affects the brain, the way the brain functions. So it becomes a disease. So parents should not see it as if it's a moral thing or moral failure on their path or moral failure on the part of the child. And the child should not be labeled as a bad boy, as a The child should be seen as he's having a disorder, a disease that needs to be treated or needs to be managed, because he didn't make up himself. As I told you earlier, that there's the causes or the risk factor for use of drugs in life is mostly genetic and environment. Yes. So if the child is having a genetic predisposition to use drugs, definitely one day with the environmental nurturing and other things, the child can go to use drugs. So we should stop moralizing the use of drugs. Start making it as if it's a bad thing. And then another myth that we do get from children is that they do my child.
They do what?
They do my child.
Okay, I think it's spiritual.
So that's a misconception. Nobody will go and just I'm laughing now. To affect your child. It doesn't have anything to do with your child. He has his own children somewhere. Why would he want to? I think they don't know what his own children are going to become in future. So why would he go and spoil your own? So there's nothing like they do my child or it's my village group that no. It's a disorder, it's a brain function. Anybody can fall a victim of drug abuse. Okay, let me give you an example.
Okay.
We give painkillers to what? To prevent pains.
Yes.
To stop pains.
To stop pains.
Yes. Or maybe you are going to take someone to surgery. You can give painkillers. With those same painkillers, we found out that they are also addictive. So when you start saying that child that is abusing that painkiller is now a bad child,
no.
It's given because the brain has been what? The brain has become dysfunctional.
Exactly. The
brain has been shown, it's so used to it that it says, no, if without this, I cannot function well. Not a bad person. But because his brain has been disturbed, so he has started having problems. So we shouldn't say that this child is a bad child, or moralizing things, or bringing spiritual things into it. These are all myths. They should be taken away. You see the child as having it. Just like the child that has fever, cancer. And if the child has cancer, we all rally, this child is going to die. Let's organize fundraising to help to solve his problem. We should also do that for those children.
Nobody says that they are bad. That's why they now have cancer. So what about drugs? It's all right.
And anybody that has a brain
can have. Because that brings me to the next thing I want to talk about, and that's the issue of the relationship between mental health or mental illnesses and drug use. From what you have said the other time, you talked about drug use disorder as a chronic and relapsing brain problem disorder that is characterized, let me just put it, by compulsive use and repetitive use of the substance despite harm that is not sustained. And that's what makes it a disorder and all that. Now, a number of people like to, okay, let me just put it straight. What's the relationship between mental health issues and drug use issues or drug use disorder issues?
It's a two-way traffic.
Okay.
Yes. Some mental health problems can lead you to use drugs.
Okay.
Using drugs can also lead you to have mental health. So most time, children use drugs when they have most of the people they have mental health issues, anxiety, depression, trauma or pain. They start abusing opioids.
Yes.
They have stress-related issues. In schools, they want to cope with school, they want to cope with peer pressure, they want to fit in. They start using drugs, and that will take them towards psychological problem, emotional problem, behavioral problem. It's the behavioral problem that will start knowing that this child is using drugs. So it's a two-way traffic. Either the drug will cause you to have mental issues, or the mental issue will now push you to now use the drugs in order to solve your problem.